my name is Sabrina Sims, and this is my capstone oral presentation over implementing interventions and standardized pain management protocols to reduce opioid use in the emergency department. Some objectives that we'll go over in this presentation are the rationale for implementing such interventions for pain management protocols in the ED, identifying risks for opioid misuse, and the benefits of non-opioid pain management strategies. Also recognizing steps to develop and implementing evidence-based pain management protocols, evaluating methods to effectiveness of such protocols, and also addressing potential barriers for implementation and strategies for sustainability. So you might be thinking, what's the big deal? And why is this topic so relevant? So let me tell you. So there is an ongoing opioid epidemic crisis in the United States and almost everywhere. This is a public health concern. EDs are the most prevalent because of we are the first responders for pain and contributors to opioid prescription rates. While opioids are effective for severe pain management, they do come with risks for misuse, dependency, and adverse outcomes. This is why it's a necessity to reevaluate how pain is managed per the CDC. The purpose for my project is to provide guidelines for pain management by implementing such standards in all emergency departments. This will provide specific guidelines for pain management practices, which encourage a decrease in opioid administration as first-line pain management relief, and this actually leads to effective pain management in patients. This also contributes to safer prescription practices. In the ER, it is often a primary source for opioid prescription for acute pain and chronic pain. With the inconsistencies of prescription practices due to limited time, this often is a quick solution to pain management relief, just to prescribe opioids. This is compounded with the high stress environment of the ER. All of these challenges underscore the importance it is to have a structured protocol that is optimizing safe and non-opioid alternatives, prescribing and providing a guideline for consistent and effective pain management for our clients and an overall safer environment for the ER. By focusing on safer prescribing habits, this aims to decrease the opioid dependence and misuse. Fun fact, well, not so fun, is that approximately 20 to 29% of patients prescribed opioids for acute pain management and chronic pain management abuse them. This information comes from the CDC, and this is why it's so important for us to combat the opioid epidemic with having protocols in place for pain management. A little further background and significance on this topic to the other information that I provided is over 70,000 opioid overdose deaths annually in the US per the CDC 2022. This is why it is so important to get a handle on this epidemic of opioid crisis. Like I said, due to the high patient turnover rate and limited time in the ER, this is why there is such a high reliance for pain relief because of opioids. In addition, the variability in pain management practice further complicates the efforts in pain management. However, recent studies indicate intriguing guidelines on non-opioid interventions within the ER that has proven to be effective in controlling pain while reducing the opioid usage. By standardizing practices in the ER, we can ensure that there is effective pain management while enhancing patient safety and supporting public health initiatives aimed at curbing the opioid addiction crisis that we've been having. As I said previously, the big problem here and the problem statement is the over-reliance on opioids to manage acute pain in the ER and the absence of standardized pain management protocols. Without these protocols, prescribing practices vary widely, leading to inconsistent care and in some cases higher opioid use. This project seeks to determine if standardized protocols can create a more consistent, safer, and effective approach to pain management in the ER. During my literature review, I found some astounding evidence-based practice to such pain management protocols. For example, non-opioid pharmaceutical options such as acetaminophen, NSAIDs, and local anesthetics are actually proven effective to manage acute pain without the risk of associated opioids. In addition, standardized pain protocols promote consistency and evidence-based decision-making, reducing inappropriate opioid prescribing and improving patient outcomes. Furthermore on that, in a study on the ER discharge practices, this found that targeted interventions like opioid sparing protocols and provider education decreased opioid prescriptions while maintaining effective pain relief. One of the critical aspects that I have found is that making sure that patients are educated on how these protocols are in place and how that we can effectively manage their pain and their expectations for pain. This demonstrates a realistic communication about pain management and actually improves adherence to non-opioid pain management techniques. Additionally, promoting multiple non-pharmacological approaches such as cognitive behavior therapy and physical therapies provides an alternative avenue for managing pain in acute settings. Lastly, staff education programs have shown a huge success in empowering providers to adapt to the opioid sparing practices, which emphasizes the need for continued professional training and awareness. All of these things can help implement these standards and pain management practices to reduce the opioid use in the ERs. Now, I know that all sounds great. However, we do have to talk about the gaps in the literature review. While there is strong evidence against and for this multiple approach for non-opioid strategies in pain management, there are still gaps in the implementation. One of the biggest challenges for integrating these practices is because how fast-paced the ER is and the time constraints that are there and limited resources which make it difficult to apply such strategies and protocols consistently. In addition, patient education on pain is one of the gold standards. However, a key factor is it is unexplored in the ER content and context. Another thing that is a gap in the literature is equity is another valid concern. As research shows, disparities in access to alternative pain management options are particular for marginalized populations. This comes from Wang and Jacobs, 2023. Another gap is a long-term sustainability of these protocols. While they show promise and real-world barriers such as staff resistance, limited resource, and a need for ongoing training is further needed for exploration. These things can limit the success of all of the pain management protocols that need to be in place. When we're talking about the proposal plan for my capstone project is and aims to implement standardized pain management protocol in the ER by focusing on multiple approaches such as patient education on pain expectations and consistent staff training. By prioritizing these non-opioid treatments as the first-line approach, this plan directly educates and addresses the associated risks with opioid overuse while ensuring effective pain management. Some key stakeholders in this initiative include patients, healthcare providers, hospital administrators, pain management specialists, and public health agencies. For patient, this project offers safer, alternative treatments that reduce the risk of opioid dependency and enhances their overall experience. Healthcare providers, including ER physicians, nurses, and pharmacists, will benefit from a structured approach to pain management, leading to an improved and safer way to treat patients, and this helps patient outcomes. Hospital administrators will also see the reduced opioid adverse effects and events and increase patient satisfaction scores. Pain management specialists will continue their expertise tailoring all of the complex cases, and public health agencies will be able to scale this evidence-based practice model to address opioid misuse in broader communities. While this has potential to improve patient safety and combat the opioid crisis, there are some limitations in evaluating its success. Some of these include the inconsistent documentation of pain management practices, variability in provider adherence to the protocols, and challenges in tracking patient outcomes after discharge. Resource constraints and patient demographics differences may also affect the scalability and consistency of its evaluation. To address some challenges, robust data collection systems, ongoing staff training, and strategies to follow up care will be essential in putting this plan in progress. To implement my plan for standardized pain management protocols, this focuses on developing evidence-based approaches that prioritize non-opioid analgesics and multiple strategies for pain management. It's crucial to involve ER physicians, nurses, pharmacists, and pain management specialists to ensure that these protocols are critically and practical and achievable. Comprehensive education for ED staff on assessing pain and communicating non-opioid options to patients is vital and key to the success of implementation. As equally important is the patient being educated and their families about the benefits of non-opioid treatments, which helps enhance the patient's understanding and compliance to the new protocols. The expected impact of this project on nursing and healthcare includes a reduction in the opioid dependency, improvement in quality care, and decrease in the opioid adverse effects. This initiative promotes a safer pain management practice, which is significant for moving forward in addressing the opioid crisis. However, there are barriers to implementation, such as provider resistance to change, the initial cost of the protocol development, and training and resource limitations in smaller facilities. Overcoming these challenges will require strong leadership, ongoing education, and phased approaches to implementation. Successfully implementing the protocols could position the ER as a model to reform in pain management, showcasing the importance of the role of nursing in opioid stewardship and patient education. After implementing the standard pain management protocols, we would expect several positive outcomes. These include a reduction in opioid prescriptions, fewer opioid adverse reaction events, and improved patient satisfaction with pain management. Additionally, we anticipate the alternative pain strategies such as non-opioid analgesics and multiple approaches to pain management interventions will be more commonly used, leading to better overall pain control. To evaluate the effectiveness of the project, we would collect data through pre and post implementation surveys that assess opioid prescriptions, frequencies, and patient satisfaction. We will also conduct a retrospective chart reviews to examine pain management practices and opioid use trends, as well as track clinical indicators like opioid-related complications. Qualitative feedback from the ER staff would also be collected to gauge their experience with the new protocols. However, there are potential barriers to evaluation the outcomes. These include inconsistent documentation across providers, variability in individual practices, and challenges long-term due to the transient nature of the ER care. Additionally, limited follow-up with patients post-discharge may make it difficult to assess the long-term impact of such new protocols. To disseminate the outcomes of this capstone project, I'll first represent the results during a departmental meeting with the clinical agency that I'm with. This will allow healthcare providers involved and that are in the implementation to provide direct feedback. Additionally, I'll submit a plan and an abstract for national and/or regional conferences, such as those as the Emergency Nurses Association or the American Association of Nurse Practitioners. These platforms allow me to share my project outcomes with a broader audience, engaging with experts and promote best practices in opioid reduction. For obtaining contact hours for continuing education, I would collaborate with education department of clinical agencies or professional organizations like the ENA, the Emergency Nurses Association, which offers CEs aligned with accredited standards. The CEs or CE presentation would be aimed at nursing and interdisciplinary staff, emphasizing evidence-based pain management strategies and opioid stewardship. However, I do want to share some insight that I had with my expert. My expert, her name is Chris Chapman. She is a nurse practitioner with extensive experience in the ER. We work together almost every day. She has been an invaluable resource for me with this project. She highlighted the importance and the overcoming resistance to change by fostering all the interdisciplinary collaboration and offering me targeted education for this particular topic. Her input reinforced the need for comprehensive training and support to ensure sustainable changes in pain management for the ER specifically. In conclusion, implementing interventions and standardized pain management protocols in the ER is a crucial step to addressing this opioid crisis that is involving patients, and this can improve patient care. This capstone project focuses on evidence-based interventions that promote non-opioid pain management strategies to help reduce opioid dependence and misuse. Engaging key stakeholders such as the nurses, the physicians, the nurse practitioners, they are essential for successful integration of these protocols in practice. Collaboration and continuous education are necessary to ensure that these protocols are implemented effectively. Ultimately, this project enhances patient outcomes and establishes a safer, more consistent approach to pain management in the ER. Thank you so much for listening to my presentation, and I hope you enjoyed it. Thank you very much.